Hello, thank you so much for joining me today. My name is Melissa Devine, and I'm with the Area Agency on Aging 1B's Medicare Medicaid Assistance Program. Today, we're going to touch base on Medicare coverage of durable medical equipment. Let's get started. We're going to cover who MAP is, what MAP does, and what's Medicare's coverage of durable medical equipment. What is durable medical equipment? And where do I get my durable medical equipment? MAP Inc. MAP counselors are certified and have been trained in healthcare benefits counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, MAP is referred to as the State Health Insurance Program, or SHIP. We're located all across Michigan, and we're offering free health benefit counseling assistance to you. So how can a MAP counselor help you? Well, we can help you understand Medicare health plans. We can compare and enroll you in Medicare Advantage coverage. We can compare and enroll you in a Medicare prescription drug plan. We can help you identify and report Medicare and Medicaid fraud and scams. And we can assist you with enrollment into low-income programs like the Low-Income Subsidy, Extra Help Program, and Medicaid. Now, let's take a look at Medicare. Medicare is health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease, or ESRD. It is administered through the Centers for Medicare and Medicaid Services, also referred to as CMS, and enrollment into Medicare takes place through Social Security for most and the Railroad Retirement Board for railroad retirees. Medicare has well-defined benefits and exclusions. It does not typically cover dental, hearing, or vision, except for under special circumstances. It does not cover long-term custodial care, and it places limits on certain care items such as physical therapy, durable medical equipment, and more. It also does not provide over-the-counter medication coverage. Medicare does work with private insurance companies to provide Part D coverage for prescriptions, supplemental or Medigap plans to help fill in the gaps in original Medicare, and Advantage plans. Those are the plans that combine parts of original Medicare with a Part D prescription drug coverage and some dental, vision, and hearing coverage. Medicare has four parts: Part A, hospital insurance; Part B, medical insurance; Part C, Medicare Advantage, which are HMOs and PPOs; and Part D, Medicare prescription drug coverage. Now let's take a closer look at durable medical equipment. Durable medical equipment, or DME, is equipment that helps you complete your daily activities. It includes a variety of items such as walkers, wheelchairs, and oxygen tanks. And Medicare usually covers durable medical equipment if the equipment is durable, meaning it can withstand repeated use, it serves a medical purpose, is appropriate for use in the home, although you can also use it outside of the home, and is likely to last for 3 years or more. To be covered by Part B, durable medical equipment must be prescribed by your primary care provider, and if you are in a skilled nursing facility or hospital inpatient, DME will be covered by your Part A coverage. Whether you have original Medicare or a Medicare Advantage plan, the types of Medicare covered equipment should be the same. Some examples of DME can include wheelchairs, walkers, hospital beds, power scooters, and portable oxygen equipment. There are certain kinds of durable medical equipment and supplies that Medicare isn't going to cover. That can include equipment that is mainly intended to help you outside of the home. For example, if you can walk a short distance on your own and get around your house, Medicare is not going to cover a motorized scooter that you need outside of the home only. Medicare also won't cover most items that are intended mainly to make things more convenient or comfortable. This can include stairway elevators, grab bars, air conditioners, and bathtub and toilet seats. Medicare is also not going to cover items that get thrown away after use or are not tended to be used with equipment. For example, Medicare is not going to cover incontinence pads, catheters, surgical face masks, or compression leggings. However, if you receive home health care, Medicare will pay for some disposable supplies, including the intravenous supplies, gauze, and catheters as part of your home health care benefit. And note, catheters may be covered as a prosthetic if you have a permanent condition. Medicare is also not going to cover modifications to your home, such as ramps or widened doors for improving wheelchair access. Now, some Medicare Advantage plans may cover minor home modifications or other items as a supplemental benefit, but you would need to check with your Medicare Advantage plan to find that information out. Medicare also isn't going to cover equipment that's not suitable for use in the home. This includes some types of DME that are used in hospitals or skilled nursing facilities, like a paraffin bath unit and oscillating beds. Keep in mind, though, that Medicaid may cover some forms of equipment that Medicare does not. So how do we get Medicare coverage for DME? Well, whether you have original Medicare or a Medicare Advantage plan, Medicare covers your durable medical equipment if you meet the following two conditions. 1, your primary care provider must sign an order, a prescription, or a certificate. And in this document, your PCP must state that you A, need the requested DME to help with a medical condition or injury, that the equipment is for home use, and, if applicable, a required face-to-face meeting occurred. Either your face-to-face visit, when required, must take place no more than 6 months before the prescription is written, and your provider should know if Medicare requires a face-to-face visit with them for the item that you need. There is a list of items subject to a face-to-face meeting for Medicare coverage that can be found online. You also, though, after having your PCP write an order or prescription, you must take it to the right supplier to get the coverage. Be sure only to use suppliers with approval from Original Medicare or your Medicare Advantage plan. There's a different process if you need coverage for a manual or a power wheelchair or scooter. If you have Original Medicare, you should get your durable medical equipment from a Medicare-approved supplier that takes Medicare assignment. You can call 1-800-MEDICARE or your local MAP counselor for a list of suppliers in the area. Our contact information is 800-803-7174. When looking at suppliers on Medicare.gov's website, Medicare-approved suppliers that take assignment are going to be noted with a $ icon. Be aware that many suppliers are Medicare approved, but they do not take assignment. These suppliers may charge you more than Medicare's approved amount for the cost of items and services. Medicare will still only pay 80% of its approved amount, so you would be responsible for any additional cost. And avoid suppliers who don't contract with Medicare, because Medicare is not going to pay for services that you receive from these suppliers. That means that you're going to be fully responsible for the entire cost. If you have a Medicare Advantage plan, you must follow the plan's rules for getting durable medical equipment. Your plan may require that you receive approval from the plan prior to picking up your DME. You may need to use a supplier in their network of suppliers, and you may get little or no coverage if you use an out-of-network supplier. You also may have to use a preferred brand. You may pay a higher cost when using a non-preferred brand of durable medical equipment. Contact your Medicare Advantage plan to learn more about its durable medical equipment coverage and their rules before you order yours. Let's take a look at the costs that are associated with durable medical equipment. Now, when it comes to durable medical equipment and whether you should rent or buy, that's going to depend on the type of durable medical equipment that you need. Medicare may require that you either rent or buy it. Now, most equipment is initially rented, including many manual and power wheelchairs. Original Medicare will cover 80% of the cost of a monthly rental fee for 13 months. That means that you, a beneficiary, would owe a 20% coinsurance. After 13 months, ownership is typically just given to you automatically. Now, in certain situations, you may have to buy your durable medical equipment. For example, Medicare may require that you purchase an item that is made to fit you. Original Medicare will cover 80% of the Medicare approved amount of the cost of the equipment, with you owning a 20% coinsurance. Now, Medicare allows you a choice as to rent or buy certain items, like the power wheelchairs and items that cost less than $150, and perinatal and enteral infusion pumps. Please note that there are different rules for oxygen equipment. Now, at some point, your DME may require repairs and or maintenance from your supplier. Repairs by a supplier involve fixing the equipment that is worn or damaged. Maintenance means checking, cleaning, servicing the equipment. If possible, you're expected to do regular maintenance yourself using the owner's manual. However, a supplier should perform maintenance if the task is more complicated and requires a professional. Medicare's coverage of more specialized DME repairs and maintenance depends on whether you or the supplier owns the equipment. If you're renting DME, as long as you're paying the monthly rental fee for your equipment, your supplier must perform all needed repairs and maintenance when a professional is required. The supplier cannot charge you for this work. If you own your DME and your equipment needs some repairs or maintenance, Medicare is going to cover the needed repairs and maintenance when a professional is required, and the services are not covered by a warranty. Original Medicare will cover 80% of the Medicare approved amount when you use a DME supplier that takes assignment. You then owe a 20% coinsurance. Please note that there are separate rules for repairs and maintenance for oxygen equipment. Now, Medicare generally only covers the most basic level of durable medical equipment to meet your medical needs. So if you want additional features or upgrades, you may have to pay for them out of pocket. For example, Medicare will cover a power wheelchair that you need for home use. But if you request a special backrest or a tilt function that's not medically necessary, you may need to pay for these features yourself. That said, Medicare may pay for special features or upgrades when your doctor includes them in your DME order or prescription. In this case, your doctor should explain why your health condition justifies the additional feature. For example, if your doctor states that you do not have the strength or the balance to lift a standard walker without wheels, Medicare should pay for a model with wheels. And if your supplier thinks that Medicare may not pay for the additional features or the upgrades, the supplier should have you sign a waiver form called an Advanced Beneficiary Notice, or an ABN. This happens to take place before you get the items. And on the ABN, you must check the box stating that you want the upgrades and agree to pay their full cost if Medicare denies coverage for them. Now, even if Medicare refuses the upgrade, it should still pay the amount that it would have paid for the basic model of the equipment. You'll then receive a bill for the remaining costs, and if Medicare refuses to cover upgrades and the supplier failed to provide you with an ABN, you do not owe the supplier for the added features. Now, Medicare will pay to replace equipment that you rent or own at any time if it is lost, stolen, or damaged beyond repair in an accident or a natural disaster, so long as you have proof of the damage or theft. Replacing equipment means substituting one item for an identical or nearly identical item. For example, Medicare will pay for you to switch from one manual wheelchair to another, but it will not pay for you to replace a manual wheelchair with an electric wheelchair or a motorized scooter, unless your condition has changed and an electric wheelchair or a motorized scooter is now medically necessary for you. If your equipment is worn out, Medicare will only replace it if you've had the item in your possession for its whole lifetime. An item's lifetime depends on the type of equipment, but in the context of getting a replacement, it's never less than 5 years from the date that you began using the equipment. This 5-year time frame differs from the 3-year minimum lifetime requirement that most medical equipment and items must meet in order to be considered DME by Medicare. The item must also be so worn from day-to-day use that it can no longer be fixed. Medicare covers repairs for worn DME if the equipment has not reached the end of its lifetime. Medicare will pay for repairs up to the cost of replacement. And to be eligible for a DME replacement, your primary care provider must write you a new order or prescription that explains your medical need. It is most cost-effective to use a Medicare-approved supplier who takes assignment. So I know we've talked quite a bit about manual and power wheelchairs or scooters. So keep in mind that you can only receive Medicare coverage for one piece of equipment that addresses at-home mobility issues. Your PCP will determine whether you need a manual wheelchair or a power wheelchair or scooter, or a different device based on your condition. But once you have your PCP's order or prescription, you must take it to the right supplier to get the coverage. For manual wheelchairs, first speak to your primary care physician if your PCP determines it's medically necessary that you use a manual wheelchair. They'll sign an order or a prescription or a certificate after their face-to-face office visit with you. The order then should say the following: your health makes it very hard to move around in your home, even with the help of a walker or cane. It is difficult for you to perform activities of daily living, such as bathing, dressing, in your own home. And you can safely use the wheelchair yourself or always have someone to help you use it. The wheelchair will help with a specific medical condition, and it will be used in the home. And you've had a face-to-face meeting with a doctor. This meeting, again, should take place no more than 6 months before the prescription is written. Now, if you think you need a power wheelchair or scooter, again, first speak to your doctor or PCP. And if your PCP determines that a power wheelchair or scooter is medically necessary for you, they should sign an order, prescription, or a certificate after their face-to-face office visit with you. Their order should say the following: that your health makes it hard to move around in your home, even with the help of a walker or cane. It's difficult for you to perform activities of daily living, such as bathing and dressing in your home. You cannot use a manual wheelchair, but can safely use a power wheelchair or scooter. The wheelchair or scooter will help with a specific medical condition and be used in the home. And once you've had a face-to-face meeting with the doctor, again, taking place no more than 45 days after the prescription is written. If you have original Medicare and you need the power wheelchair or scooter, your provider or supplier should first contact Medicare and find out if you need to request prior authorization. Prior authorization means that Medicare must be asked for permission before you can get a certain service or item. This requirement only applies to certain power wheelchairs and scooters. Now, please note that if you need power wheelchair or scooter that is not subject to prior authorization requirements, you may instead need a signed order from your PCP or original Medicare to cover the device. Your provider or supplier must send the prior authorization request to the Durable Medical Equipment Administrative Contractor, and the DME, Medicare Administrative Contractor, will respond within 10 business days or sooner if your health would be harmed by going without the equipment. They're going to either approve or deny the request. If they authorize your equipment, your supplier will provide the equipment and you will owe your normal Medicare cost-sharing amounts, including deductibles and coinsurances. If they deny the prior authorization for your equipment, your provider or supplier can request such an authorization one more time, giving more reasons as to why you need the power wheelchair or scooter. If you're denied again, it is unlikely that Medicare will pay for your durable medical equipment at that time. Now, if you choose to get durable medical equipment after denial or prior authorization, your provider should have you sign an Advanced Beneficiary Notice, or ABN. This notice states that you understand that Medicare will not cover the requested DME and that you are responsible for the full cost. Make sure you select the option to ask the supplier to still submit a bill to Medicare. If Medicare denies the payment, you have the right to appeal. We've also been discussing Medicare's specific coverage rules for oxygen equipment. So Medicare's coverage and rules for oxygen equipment rental, repairs, and maintenance are different from the rules for other durable medical equipment. Oxygen equipment includes portable oxygen tanks, and you should keep in mind that you should still use the right kind of supplier to limit your costs. Unlike other DME, oxygen equipment is always rented in a 5-year cycle, and you never have the option to buy it. Medicare will pay the supplier a monthly rental fee for the first 36 months. The fee includes all equipment, oxygen, supplies, and maintenance. You owe 20% of each month's rental fee. After the 36-month rental period, you pay no more rental fees. Although the supplier still owns the equipment, you keep the equipment for up to 24 additional months. If you use oxygen tanks or cylinders, you continue to owe a 20% coinsurance for oxygen each month. You will also owe coinsurance for any needed maintenance during these additional 24 months. At the end of 5 years, though, you will have the choice to either get new oxygen equipment from your supplier or to switch your supplier in general. If you need the oxygen equipment for less than 5 years, the supplier will take it back when you no longer need it. And throughout your 5-year rental period, the supplier must keep your oxygen equipment in good working condition. During the first 36 months of the rental period, the supplier must provide you with supplies and maintenance free of charge. During the last 24 months, providers are allowed to bill you for in-home maintenance visits every 6 months, and you must pay a 20% coinsurance for that. Medicare fraud, errors, and abuse involve a wide range of behaviors that result in unnecessary costs to the Medicare program. It's important to recognize potentially fraudulent activities by providers and DME suppliers. Some examples of DME fraud and abuse might include when a supplier wants you to use their doctors rather than your own, and these doctors then prescribe unnecessary medical equipment. If someone steals your Medicare number, uses it to bill Medicare for DME that you do not need and or was never delivered. If someone calls you or visits your home to offer you free equipment that you do not need and then bills Medicare for the equipment. For example, you might receive a phone call from a telemarketer who asks if you're experiencing any pain. If you say yes, the caller may ask for your personal information, like your Medicare number, so that they can send you a knee brace or a back brace to help with the pain. This is likely a fraudulent call. You should not provide the caller with any personal information. If you receive a call like this, contact your senior Medicare patrol, which is also MAP. We can assist you with reporting these behaviors. For beneficiaries who willingly allow their Medicare number to be used in exchange for money, gifts, or unnecessary equipment and supplies, DME supplier bills Medicare for more expensive DME than you've actually received. If a DME supplier continues to bill Medicare for rental payments for your DME after it's been returned. Remember, the rules about Medicare's coverage of DME. Medicare should only cover DME that your doctor has certified you need. There must also be documentation in your medical records supporting your medical need for the equipment or supplies. So if you do need DME, ask your doctor about whether you meet the coverage requirements to get it. If you do, get your DME from a supplier that accepts Medicare assignment. Or, if you have a Medicare Advantage plan, from their in-network suppliers. But be aware. Be aware of aggressive marketing that tries to persuade you to change your DME providers. Never sign a blank form with your healthcare provider or equipment supplier. And before making a decision to change suppliers, speak with your doctor and your current supplier to see if there's a need for your change. Do not accept money, gifts, or unnecessary equipment and supplies from a supplier in exchange for your Medicare number. Do not respond to ads that offer free equipment to Medicare beneficiaries. Be skeptical of offers. If they seem too good to be true and don't give your information out, they likely are too good to be true. And protect your Medicare number. Only give your Medicare number to your doctors and other trusted providers. Check your Medicare summary notices. If you have original Medicare or your explanation of benefits, if you have a Medicare Advantage plan, and your billing statements regularly. Carefully look for any suspicious charges or errors. Also, remember that providers are not permitted to routinely waive cost sharing or offer gifts for financial incentives for you to receive services from them. If you see suspicious charges or have any reason to believe your provider is inappropriately billing Medicare for DME, call your provider. See if they've made a billing error. And if you suspect that the healthcare provider is committing DME fraud, contact MAP. Let us help report that activity. MAP's here to help. If you want to speak with a MAP counselor about your specific situation, give us a call. Our number is 800-803-7174. Our service is always confidential, unbiased, and we're currently offering counseling over the phone and Zoom and some places in person, depending on the location. But no question is too trivial, and we often deal with very complicated questions as well. So please give us a call. And for more resources outside of MAP, you have access to the Medicare and You Handbook, which is delivered to you in the fall each year. It is state specific and it will show specific plans for Michigan. If you need an electronic copy, you're able to give us a call at MAP here and request one. You can also request a copy through Medicare's website with medicare.gov and give 1-800-Medicare a call. However, your best resource for local Medicare information is MAP. Again, our services are free, they're unbiased, and our certified counselors are not sales agents and are not affiliated with private insurance companies. We can be your best resource for all questions and concerns Medicare. There's no question that's too small or difficult, and we've saved over $2 million for beneficiaries in your area. So give MAP a call. Thank you so much for joining me today. If you have any questions, especially regarding our presentation today, feel free to reach out to me. My name again is Melissa Devine, and my email address is listed here on the slide. It's mdevine@aaa1b.org. Have a wonderful day.